All right, so we'll now talk about the lumbar vertebra. So unlike the cervical vertebra, which we said there were going to be 7 in number, then thoracic vertebra, which were 12 in number. The lumbar vertebra, they're going to be 5 in number. So these are our lumbar vertebra. We're going to have L1, L2, L3, L4, L5. And in between, we're still going to have intervertebral discs. Right. And structure-wise, we're still going to have the same structure, general structure that we had on a thoracic vertebra, just that our lumbar vertebra, they're going to be a bit massive because they also now have more weight or body weight to bear, right? So I remember the other time I told you that we have identifying features or distinguishing features for different parts of the vertebra. For example, I told you that thoracic vertebra, the hallmark feature for thoracic vertebra that distinguishes them from all the other vertebra was the presence of demifacets on the body for a thoracic vertebra, which would be for articulation with your ribs rather. Right. Then for cervical vertebra, I told you that they're going to have a bifid spinous process, though not all of them. Then we also said that they're going to have a foramen within their transverse process, right? So we also have unique features that we ascribe to our lumbar vertebra, right? The other time I was telling you that there's a heart in the thorax, which we use to remember that the body of a thoracic vertebra, it's heart-shaped. In the lumbar region, there's a kidney, right? So the body for a lumbar vertebra, it's going to be kidney-shaped. It's the same thing to say kidney. It's the same thing to say bin. It's the same thing to say reniform. So it's kidney-shaped, or you can say bin-shaped, or you can say reniform-shaped, right? And these lumbar vertebra, we can distinguish them from thoracic vertebra because of these massive bodies that we're saying they're almost bean-shaped. I think you can see from this picture, right? And they don't have costal facets on their sides for the body, right? Then if you look at the spinous process for a lumbar vertebra in general, for cervical, remember we said it's short and it's going to be bifid, with the exception of that for C7. For thoracic, we say they're going to be long, slender, and directed downward, with the exception of T1. I remember telling you this when we we're doing the other lectures. So for a spinous process for a lumbar vertebra, it's going to be thick. Then you can see here, it's thick and it's almost quadrilateral, four-sided in shape. Right. So common things first. We describe a typical lumbar vertebra. Then we now look at the ones that are atypical and now describe how different they are. Right. So features for a typical lumbar vertebra, I've already given some. A body that is kidney shaped and it's massive. So there's a huge body and it's kidney shaped. Right? And you can see that this transverse diameter for your lumbar vertebra, it's greater than this anteroposterior diameter. These are just some things that you can see from a picture without needing anyone to tell you. And since I said they are larger than thoracic vertebra due to the fact that they are weight bearing. As you go down, they increase in size because L1 carries maybe, let's say if it's carrying, for example, 20 kgs, L2 will carry more than that, L3 will carry more than that. So they increase in size as you go down. Right? Meaning L5 will be the most massive or the huge one. Right? Then let me clear this. Then when I described cervical vertebra, I told you that there is a vertebral foramen in the lumbar region that is almost the same as that in the cervical region. I said it's large, number one. Number two, I said it's triangular. The only difference is that the cervical one is the largest. So they are both large and triangular, but the cervical vertebral foramen is the largest because the spinal cord is largest in its cervical segments. Because of the cervical enlargements, as well as it carrying all the tracts in the cervical region coming from the lower body and also coming from the brain. So everything is in the cervical region before they go to their respective places. So vertebral foramen, it's large and triangular in your lumbar region, but it's not as large as the cervical region. Right? But definitely it's larger than the one that I showed you for thoracic region, which we said it was going to be small and circular. Right. All right. Then this vertebral arc, this is going to have the same thing. I gave you a mnemonic: pulp, pedicle, anterior, lamina, posterior. Right. So these are your pedicles. Where a pedicle meets a lamina, there is a transverse process. Where the two lamina meet, there is a spinous process. The spinous process is the one that I said it's thick and it's quadrilateral in shape. Right. So there's a pedicle, there are lamina. Where pedicle meets lamina, there is a transverse process. Where the two lamina meet posteriorly, there's going to be a spinous process. Right. So describing each now, then you can see that the pedicles here are quite short. So the pedicles are short, they're a bit broader, and they look almost thick as well. They're not as thin as in other regions. So there's a very short pedicle, it's thick, and it's broad. Right. Then you look at the lamina here. The lamina are also going to be short and thick, and remember they're meeting to form this spinous process, which we said it's quadrilateral in shape. It's projecting backward, that spinous process. Right. Then these are your transverse processes. They are thinner compared to the pedicle and the lamina. These are going to be thin, right? And these transverse processes, they are described as ribs of the lumbar region. Remember, there are no ribs in the lumbar region. So these transverse processes, they're a bit longer and they're described as being the ribs for that region, right? Okay. Then I also have facets here. We have superior articular facets. So if this is L4, these superior articular facets articulate with L3 above. Then I'm going to have inferior articular facets that articulate with L5 below. Right? Remember the zygophysial joints? So these facets, they have a direction as well. I think this one you can already see that these superior ones, they are like where they are facing. They are facing medial. Okay, so they are projected backward and medial. And I remember telling you that if you know that for a superior, for the inferior, it's going to be the reverse. So the inferior ones are going to look lateral. Let me see if I have a picture. These ones, they're going to look outward, like these ones, compared to the superior ones, which are looking medial. They're going to look lateral or outward, and they face forward, versus the superior ones, which face backward and medial. So you only need to remember one to know the other one, right? Okay. Then this is maybe distinction student. On your superior articular facet, there's something that we call a mammillary process. This one here. So that's your mammillary process. It's a rough elevation which marks the posterior border of your superior articular facet. So we call it a mammillary process. Right. So having described that, that's a typical lumbar vertebra. They are then the atypical lumbar vertebrae. The atypical, we have L5. So what do you do to remember the atypical? You just remember what's different about it compared to the other ones, right? And when you want to compare it, we may not find an L5 vertebra here because of it's an atlas, but L5, remember I said the transverse process for these other ones is going to be longer. For L5, it's going to be very, very short. It's also going to be thick, unlike the ones that I said, they are thin and long, right? Then the spine for L5, it's also short and small. It's not as thick as L1 to L4, which we say they are thick and quadrilateral. Then the body is largest, of course, for L5, because I said they increase in size as you go down. Right. Okay. Then let me see if I have something that I want to add. Then in relation to the spine, right? Come back here. In relation to the spine, right? So this is how we have 7 cervical vertebrae in green, then the 12 thoracic vertebrae in the brown orange, then the purplish lumbar vertebra there, right? In relation to the spine, I'm also going to have ligaments, right? I'm going to have ligaments. These are ligaments that are going to hold be the vertebra in position. They are muscles as well. The muscles, I'll talk about them separately because it's another talk on its own. But ligaments in this region include your longitudinal ligaments. So longitudinal ligaments extend all the way down to this region. So there's anterior and there's posterior longitudinal ligaments. Better. Then maybe this will help you when you guys do thorax. When you do thorax, the most important muscle for inspiration is the diaphragm. The diaphragm, when you describe it, it's going to have 3 origins. And one of those 3 origins is going to be a vertebral origin. And that vertebral origin originates from these lumbar vertebra. We're going to describe something that we call a right cruce, then something that is called a left cruce. Right. The right cruce will originate from L1, L2, L3. The left cruce will originate from L1, L2. We'll do that when you do the thorax. And these are just some important things that are touching on your lumbar vertebra. Right. Then we also have ligaments. Some of them I won't mention, but there is ligamentum flavum. It's the same as those above. Then we also have attachment for thoracolumbar fascia. If you're doing upper limb, you remember there was a muscle called latissimus dorsi, which latissimus means extensive. It's going to the upper limb, yes, to the floor of the bicipital groove, but it actually originates from lower down there. Right. And one of the origins is going to be this thoracolumbar fascia that we are saying it's also attached way onto this lumbar column, lumbar vertebral column, specifically the tips of your transverse processes. And so some of these things you don't need to get them now, but when you then do say muscles of muscles that attach the vertebral column to the upper limb, you get that there's a muscle called latissimus dorsi that does this, moves from here, inserts there. Function wise, it helps with medial rotation, it helps with adduction, and it also does extension. Okay, so we'll do that when we do the muscles. Right? But just now, just remember that there's a lumbar vertebra there. Right? Then there's something called sacralization. This is a phenomenon where the last lumbar vertebra, after lumbar, there is sacrum. So sacralization is whereby the last lumbar vertebra resembles the sacral vertebra. Right? Not necessarily resemble, but it is fused to the sacral vertebra. So that's going to be called sacralization. Right? Then there's a condition quite important that we call spina bifida. So spina bifida can be described in many angles, but what generally happens in spina bifida, be it the mild to the severe, this is where the vertebral arc is not closed. So this region here, it will be open, and the spinal cord and the meninges, which will be lying within the vertebral foramen, will be exposed. Right. So spina bifida can be caused by failure of this vertebral arc to fuse during development of the somites. Not knowing if you guys have done embryology of the vertebra. So this vertebral arc may fail to fuse, then everything in the vertebral canal will be exposed. That's spina bifida. Right. Can also be a problem of folate deficiency, which is why every pregnant woman is advised to take folate in the first 4 weeks, right, of their pregnancy. Birthing in Africa, unplanned pregnancies, and someone who only know maybe 2 months down the line, right? Then there's something called spondylosis. So I'll write the spelling down for you. So these are the spellings here. So there's spondy. Don't mind my handwriting. There's spondylosis. Then there's spondylolisthesis. Right, there's an N, that's a D. Spondylolisthesis. So you have spondylosis, then you have spondylolisthesis. These are two different things. Right. So in spondylosis, right, remember the vertebral column is like this. There's L4 here. I'm going to just draw it like this. Then there's L5. Then I go to sacral vertebra. There's going to be S1 there. Right. So for someone with spondylosis, right? For someone with spondylosis, right? L5, right? Remember, let's use this diagram here. This is the body. So we have body here, then we have vertebral arc behind here. So for spondylosis, there is separation of this body from this vertebral arc. Why can't I draw right? So this is the vertebral arc. Right. Then the body is the X there. So spondylosis, there is separation of that body from the vertebral arc. Right. Spondylolisthesis. The vertebral column is supposed to be like this: L4, L5, S1. For spondylolisthesis, the other one slips forward like that. So instead of having L4, L5 like that, you have something like this. So it becomes like this. Right. So there is forward slippage of the vertebra above on the vertebra below. And normally it happens at L5S1 because there is something called a lumbosacral angle. They are not that congruent. There is that normally one slips a bit anterior, but due to that incongruency, spondylolisthesis normally happens there where L5 slips forward on top of S1 rather. Right. Then if you remember your neuro, the spinal cord ends between intervertebral disc L1, L2, and that's where we have the conus medullaris. Conus medullaris, if you remember the spinal cord well, that's where you get the sacral nerves as well as the coccygeal nerves. Then in the vertebral foramen of all the other lumbar vertebra, there is the chorda equina going down. So fractures of lumbar vertebra can lead to something called chorda equina syndrome. You are not affecting the spinal cord per se, because the spinal cord has ended at the intervertebral disc between L1 and L2. So if you get a fracture at L3, you affect the bundle of nerves that is now going down, which is no longer the spinal cord. That bundle is what we call the chorda equina. And you get something called a chorda equina syndrome. So it now depends with which nerves have been severely affected, and that determines the symptoms that are going to come about. Right? But there's going to be problems within the lower limbs. Right? And you may also have absence of the reflexes in the lower limb. That's the knee-jerk reflex and the ankle reflex, because all the nerves going to the lower limb would have been affected. Right? Then when we do pelvis, particularly the bladder, you're going to see that there's something called a lower micturition center. Right? Controlled by S2, S3, S4. So those nerves are also traveling in the chorda equina. So you will have neurological problems with the bladder, which is failure to control the sphincters of the bladder. It's a whole lesson on its own, but you get to understand how other people can have an automatic bladder, others autonomous. What? Automatic is a bladder which, when it fills, automatically empties. Autonomous, continuous dribbling of urine. Right? Those are some of the things we'll now describe when we do the pelvis anatomy in regards to the bladder. Right? But this alone tells you that skeletal system, or should I say orthopedic medicine, is quite important because it links everything. Everything is linked to the bone. A fracture of a bone can present with someone failing to urinate, for example, or someone continuously urinating. So these are lumbar vertebra. So take home message about lumbar vertebra. They have a body that is kidney shaped, vertebral foramen that is large and triangular. They have a thick quadrilateral spinous process. They increase in size as you go down, right? Then we said they in this region, normally that's where we usually have spina bifida. I didn't give you the reason why spina bifida is common in this region, but if you go back to basic embryology, right? Formation of the neural tube, we have a cranial neural pore and a caudal neural pore. Cranial neural pore, you remember, closes day 25. Caudal closes day 28. So things that happen last are more likely going to have a problem. Right? If Jenny gets $20 on the 5th, then Chipo gets $20 on the 8th. If the person giving out the money is broke on the 5th to the 8th, then they decide to give the money on the 20th. They will still give Jenny first. Right? That's what simply happens here. So caudal neural pore closes late. That's for neural tube development. That's why spina bifida is more common in this region, the lumbar region. Okay. Do you guys have any question on lumbar vertebra? Any question or things that you want me to repeat? Hello.
Hi.
Yes.
Personally, I want to know. You talked about yeah, spondylolysis, something like that before. You said
Spondylosis.
what happens there? I got the fact that able that one.
Spondylosis, there is separation of the body from this vertebral arc.
Okay.
So normally it's separation of the body.
Just on the.
Sorry?
I'm saying it's just only on the 5th lumbar bone, vertebral bone.
No, it can happen anywhere, but normally they occur there.
Oh, I get it.
Right.
Okay.
So there is usually separation of the vertebral body from inferior articular facets on the vertebral arc of L5, if you want to be specific.
Okay.
Then spondylolisthesis, that's where there is the forward slippage of the vertebra on top on the vertebra below. They lose the normal congruency of your vertebra.
Okay. Thanks.
Okay. Any other question again on lumbar vertebra? Okay.